morning. My name is Ethan Welch, partner here at Hickman and Louder, and we also have my co-presenter Janelle Leonard. She's our care coordinator, licensed social worker, um, that will also be filling in the details with me. We are first going to start off our elder law talk series with the 5 steps to proactively plan for long-term care. As elder law attorneys, you know, we are estate planning attorneys, of course, where you think of drafting your powers of attorney, your last wills and testaments, your trusts, but the elder law component of this is also Medicaid planning and planning for your care as you age, and planning for your loved ones' care as they age. And that's what sets elder law attorneys apart from typical estate planning attorneys. So let's get started here. The 5 steps that we're going to review today. First, we're going to discuss current needs and anticipated care needs, for yourself or for your loved ones. Then we're going to discuss, finances. How are we going to pay for this care as we age, as our loved one ages? Then we're going to talk about estate planning documents and your advanced directives, your healthcare documents, to make sure that we have the right agents in place and the right documents in place for your care needs. Then we're going to talk about creating backup plans, because even though you might have a plan in place, health changes, family changes, your agent changes. So we want to make sure that we have, multiple plans in place in case our plan A or plan B fall in the wayside. And then we're going to talk about preventing abuse, neglect, and financial exploitation. I think that we see a lot in the news that there's scammers out there. There are nefarious characters, nefarious family members that take advantage and leave family members destitute or in a horrible situation with their healthcare needs. So we're going to talk about ways to prevent that and ways to combat that if it does come up into play.
Ethan, can you share your screen again?
Oh yeah. There we go.
Nope, it's still not. Oh wait, there it goes. All right, we're good now. Sorry.
Sorry, everyone. We're getting the first first presentation jitters out of the way here. So here are the 5 steps that I was talking about. That this is what we're going to talk about. Once again, we recorded this. We'll provide the presentation slides and the recording very shortly after the presentation. So I love this slide because it shows the care continuum of what are our care needs and what are the levels of care that one needs. And you can see that as you age, it's going to cost more money. And how are we going to pay for that care? And that's what the bottom of this slide shows, that you're going to use private funds, the cash in your bank, your retirement accounts, any benefits, community services, your Social Security, caregivers, and then we also have, of course, Medicaid and Medicare. And all that ties all in together of How are we going to pay for our needs, whether that's living in home, whether that's assisted living, whether that's going into a nursing home. The continuum of care that we're talking about is, as you age, you're going to need more support. So whether that means, hey, am I going to have caregivers living in the home? Is that going to be private caregivers? Is that going to be family members? Is it going to be community support? How are we going to pay for those? Are we going to pay for those caregivers with our private funds? Can we get on any benefits like Medicaid with the PACE program, Passport, which we'll talk about a little bit, or any VA benefits if you are able to receive VA benefits from a spouse or from your service that you've committed and are able to receive VA benefits. If living in the home just doesn't make sense or you just can't, well, then the next levels come into play here where we have independent living, assisted living, rehabilitation and skilled care after a hospital stay. And then we have, of course, nursing home level of care, where that provides 24/7 care at a facility. So this continuum of care means as you age, you might need more support. That doesn't mean that if you are in skilled care at a rehabilitation center, you can't go back home or you can't go back to independent living or assisted living. Um, it can jump from more care to less care. Um, but as as you can guess, and as many people realize, that as you age, you do need more support. You do need more care.
So the most important question when we're looking at the continuum of care is your level of care. That's always our biggest question. And that's a lot of what I do at the firm is working with families and individuals, clients to determine what their level of care is. So it's really important if you're thinking about the future to talk about what your current needs are versus what you anticipate your needs to be. And that can be, determined on a number of factors. But if you have a certain diagnosis, if you know the general course of the disease is that you're going to need more help down the road, it's important to kind of come up with those sort of different levels of care and what's important. Part of that is looking at your, I know I put letters there, IADLs and ADLs. That's independent activities of daily living. That includes things like communication, being able to communicate with people, let them know what your needs are using the phone, shopping, meal prep, maybe some housekeeping. So those are sort of those general like daily activities that you might need a little assistance with. Activities of daily living, or the ADLs, are really what we look at as far as like a set of skills that's a little more in depth than just your IADLs. So that's your bathing, dressing, being able to ambulate on your own, being able to feed yourself, those types of things. So those are always, you'll hear ADLs all the time, especially if you are working with any of the Medicaid programs. Activities of daily living really determine sort of your level of care and what makes you eligible for services and what may not. It also plays in if you're looking at if you require 24/7 care. So for example, someone who's newly diagnosed with dementia may not need 24/7 care. But down the road, as we're looking at our anticipated care needs, there is a chance that they're going to need an increased level of supervision. So those are important things to think about. Another thing that we look at is your support system. And these could be natural supports. Not everybody has family around them or in the state that can be there to help them. These could be neighbors. These could be group buddies. They could be from your religious institution. Looking at those support system people and determining who's going to be helpful for you, who's willing to be there for you and able to be there for you, and always having a backup plan. Another part of being in one of the Medicaid programs like Passport or PACE is having that backup plan. So even if you have paid caregivers coming in, they get sick, they have childcare issues, car issues, you name it, people get sick. So you want to make sure that you have a backup plan in place. And that doesn't mean somebody who says, oh, yeah, I'm your backup plan, put me down. But really, if you're in a situation where you can't get to the bathroom, what is the backup plan? Is that a family member or a neighbor, or is it someone from the local senior center? So it's important to think about all those aspects when you're thinking about your future needs. Another thing is equipment accessibility. So we talk a lot about this, and a lot of what I do is I will investigate people's housing and determine if they need certain equipment. For example, a stair lift. Maybe getting up and down the stairs is really a problem, but they have the ability and the means to be able to get a stair lift put in their home to get up to the second level. Accessibility. Can you, let's say, a common one that we see pretty frequently is someone falls and breaks a hip. They go to the hospital, they have surgery, they go to rehab, they want to go back home. Can they get up and down into their home? You know, how many steps are leading to the porch? Is it a situation where we now need a ramp? Or do we need a ramp even in our garage to try to get in and out of the house easier? So looking at those things like the other big question is getting, and it leads into safety, is can you get out if there's an emergency? So one of the big questions that we normally ask people is, do you know what to do in case of an emergency? And some of you might laugh, but a lot of times I get individuals who will say, oh, I'll call my daughter. Well, great. But if there's a fire going, I want to hear you say, I call 911, or I get out of the house and call 911. And are you able to do that? A lot of people don't think about that. They say, I have everything I need right here. But if there is a fire, they can't get out of their house. So that's something to think about. And I try to remind families and caregivers that that's a big part of it. Also, you know, if someone is in a regards to safety, if someone's in a home situation and maybe their spouse, they have a history of domestic violence or possibly an abusive caregiver, if you know that and you're trying to help someone plan ahead, obviously that's an unsafe living situation, and we want to try to help um, you know, get them out of that situation or not leave that as the plan. So sometimes that requires a little extra help, but those are things I look at as far as safety, and what would be possible for being at home. Now, levels of care can really change over time, like Ethan mentioned. And one of the things that I always like to point out is educate yourself. Like, so for example, if there's an emergency, let's say someone has a stroke and they end up needing, let's say, a trach to help them breathe, a tracheotomy, and they need help breathing. Those are, knowing what your options are for care is so important, because a lot of people just assume they can go home at some point with that kind of care, but that kind of care is not something that home care will provide. So it's really important when we're talking, if you have a loved one that's in the hospital, or you are facing some medical difficulties, we need to talk about what all the options are realistically, because sometimes it's just not possible to get the care you need in your own home, or sometimes even in a facility. So it's really important. Level of care also comes into play if we're talking about individuals with special needs that are connected with the developmental disability system versus the aging population. So their care needs might be met through the DD system at an ICF or a group home, versus if we're talking about someone in the community, or maybe they're in an assisted living and they need a greater level of care, they might need to move to a nursing home. So it also kind of falls down into those two categories of care needs, depending on the system that you're connected with. So level of care is just a really important thing to start talking about and thinking about, and what your plans will be, you know, as your level of care changes.
So how are we paying for our care? You know, obviously the first, you know, option is privately paying. But we all know that care, whether that's in-home care, whether that's assisted living and nursing home level of care, can be incredibly expensive. So what options are there out there to, you know, help alleviate those, you know, that stress of having to deplete your savings in order to pay for your care. Well, one option is purchasing a long-term care insurance policy. Um, the long-term care insurance policy, if you meet a certain level of care, will start paying for those services. It depends on the plan that you would purchase. Some plans cover in-home care, some plans cover assisted living, some plans only cover nursing home level of care. And each plan then would only pay a percentage for that care. Um, the problem with long-term care is there is the premiums can be incredibly expensive, especially as you age. The premiums go higher and higher. Um, Companies often would drop policies um, because it's just too expensive for them um, to keep. So they will, they will stop the policy and return, any payments, or they will keep the payment there and only then cover a certain what you've paid in at that point in time. Um, so a question that came up was what would cause companies to drop policies, and could that happen if policy has already been purchased? Absolutely. It could happen. Um, the fine print in many of the policies, state exactly that um, if the company, you know, decides to stop the long-term care portion of their insurance, then you know that's just it. There's no recourse to that. The premiums will stop, obviously, and you should be able to get what you've paid into it, but that will, if 10 years later you need, you know, nursing home level of care, well, what you anticipated, what the long-term care insurance would be covering, isn't there. It'll pay a very small percentage. Um, there's an eligibility component to this. Prior to payment on the claim, meaning some policies have a 90-day probationary period before you have, um, before you can receive that benefit, you have to wait 90 days. So you have to private pay that 90 days before the insurance would kick in. Another question, is it true that you have to have a certain number of health challenges in order to have long-term care insurance? Um, you have to meet their level of care. So you need to have it, um, depending on if the insurance policy says, yes, we'll cover assisted living coverage. Well, obviously you need to have the ADLs in order for you to receive assisted living, and that is all provided to the long-term care insurance company. They will then do an assessment of you themselves, and they will keep doing that assessment every year to determine, do you medically qualify for this long-term care insurance policy that you have. And like I said, this some cover all through the gamut here of in-home care, assisted living, and nursing home. Some only cover only nursing home. So it all depends on what the specific policy covers. The other payment option is Medicare. But Medicare is very limited to what they will cover. Um, the Medicare component of this is, for you have to be admitted to the hospital for a 3-day stay. So Janelle and I discussed this when we were doing the slides, that the admission part of this is incredibly important. Sometimes you go to the hospital and you're there for 3 days, but you were never actually admitted. You were just being observed. That doesn't count as an admission. So that's key when you go to the hospital. Talk to the staff about, hey, am I being admitted? Is my parent being admitted, or is it just under observation? If there is no supplemental policy, the first 20 days would be covered after a hospital stay at a rehabilitation. But after the 20 days, the price would decrease. So generally it's 80% after between 20 and 40 days, 60% from 40 to 60, and so on. So that percentage would decrease the longer you're there at the rehabilitation. If there is no supplemental policy, if you have a supplemental policy, maybe the supplemental policy will cover that percentage that you're losing if you're in rehabilitation more than 20 days. But at any time though, from 3 days to 100 days, so Medicare covers up to 100 days of rehabilitation. At any time during that time period, they can cut you off if you have plateaued in your recovery, in your rehab. If or you just can't do your therapy anymore, or you're just unwilling to do therapy, then Medicare will say, we are not in the long-term care coverage business. We are in the rehabilitation business. So at that point in time, your your options are, if you don't have a long-term care insurance policy, is to private pay or apply for Medicaid, because we don't know how long you will stay at the skilled care or at a nursing home. Um, the other payment option that's available for some are veterans benefits. So primarily that's aid in attendance. Aid in attendance provides a monthly benefit to cover additional medical care. Um, this covers in-home care and assisted living. It doesn't cover nursing home care. So if you are on aid in attendance at an assisted living and your level of care um, depletes where you need to go to a nursing home, well, the aid in attendance benefit will decrease to only $90 a month. And at that point in time, you have to get on Medicaid or private pay. Um, but there are other options in the state of Ohio, where there are state-run VA facilities. There's only two. There's one in Sandusky, and there's one in southern Ohio in Georgetown, which is in Brown County. These facilities are, have skilled care and nursing home level of care. The difference is the price of admission to this is drastically less than where you'd private pay at a other nursing home. So nursing homes, as we all know, are over $10,000 a month. Many of them are getting creeping over the $15,000 a month threshold. The state-run VA nursing homes, those are very, very less. They're around $3 to $4 to $5,000. They do a calculation based off your income to determine how much you pay, but it's far less than where you would get at a typical nursing home. So then the option then becomes, I don't have long-term care insurance. Medicare's kicked me off. I'm not a veteran, and my spouse wasn't a veteran, so I don't qualify for VA benefits. My options are, I'm going to private pay, or I can get on Medicaid. We're going to talk about in the next coming months about how to qualify for Medicaid. I'm going to talk to you today about the major points of Medicaid here, because we're here starting the presentation and how to proactively plan for long-term care. But the gist of Medicaid is for a single applicant, you have to have resources below $2,000 and your income has to be below $2,829. If you fall below those thresholds, then you can get on Medicaid. And these Medicaid looks like in Ohio, the in-home Medicaid, which is with the PACE waiver, or the passport waiver. What that basically is saying is when we say a waiver is Medicaid is waiving the requirement that you be institutionalized to receive Medicaid benefits. They want you to be in the community. So if you qualify for, financially under these thresholds and you meet the level of care to receive in-home support with Medicaid, you could qualify for the PACE waiver or the passport waiver. Then we have the assisted living Medicaid waiver, which is assisted living, being in an assisted living, having that level of care, and having Medicaid pay for your care above what your patient liability would be. Patient liability is your income. So essentially, your income is paid to the facility. The Medicaid waiver, whether that's the assisted living waiver in this case, would pay for the excess amount to the assisted living. And of course, then we have the nursing home Medicaid, which is the long-term care component. That would cover the full stay above the patient liability. So instead, if your income is $2,000 a month, the nursing home is $10,000 a month. Well, your income is paid as your patient liability, and Medicaid would pay the balance to the facility.
Just a
So
quick note, I'm sorry, on the
yeah, go ahead.
assisted living waiver, not all assisted livings take the Medicaid waiver. So it's important to remember that. I know a lot of people go and look at assisted livings, but not all of them do take the Medicaid waiver. So if that's something you think you're going to need down the road, or if you're facing an emergency situation and you're trying to figure out placement options, if someone does not have the funds to private pay, then it's important to ask about the Medicaid assisted living waiver. The other thing is that some assisted livings will require a private pay period. So for example, Devon Oaks in Westlake, beautiful facility, wonderful. They require a 3-year private pay period, typically. Now, I say that typically because sometimes that changes. It's up to the assisted livings if they require private pay prior to taking the Medicaid waiver. Sometimes that varies. Like during COVID, there was a lot of empty beds, and so they were trying to fill their beds. So they were taking people without worrying about the Medicaid, like without worrying about private pay. As their beds have filled up, they can require some private pay period before they'll allow the Medicaid waiver. So I just wanted to throw that out there. And I see there's a question, what's the difference between PACE and Passport? So PACE is a program of all-inclusive care for the elderly. It started in Cuyahoga County, and there was a program in Cincinnati. It has now just gotten approved. It's very exciting for Lorain County. They're moving into Summit Lake, Medina. I'm probably throwing a couple in there, but it's going to expand. And it's kind of, so Passport, so I'm getting to that. Passport provides in-home care. They provide aids. They provide home health aids. They provide equipment as needed, and it's if you qualify for it. They also provide things like Depends, chucks, which are those pads that you can put down for accidents. They provide an emergency response button. PACE is like Passport Plus. So what they do is they take Passport and then add additional services. PACE becomes basically your insurance provider. You see PACE physicians, and they have a day center. They have like extra services that Passport doesn't provide, but it's in a certain area, and you fall under their umbrella of care. So they're both really excellent programs for trying to stay home. I preface that with there is a shortage of home health care aides in Ohio right now across the board. Like it doesn't matter if you're talking about a facility or if you're talking about in-home care, there is a huge shortage. So keeping that in mind, it can sometimes be difficult to find home care aides through any program, or even at a facility, especially in some of our underserved areas, like further out where they're kind of in the middle of nowhere. There's less aides that are available. So some of the counties have a little more to choose from than others, but both are really excellent in-home care programs. Do these programs include in-home caregiver support? So yes, the goal for both PACE and Passport is to be able to provide an in-home caregiver to give families a break. Sometimes family members are the aides, so it depends on the situation, but yes, for the most part, they are supposed to be providing you with respite, giving you a break. Passport also and PACE both cover respite time. So if you're going out of town on vacation and your loved one is not, cannot be left alone, they sometimes will pay for a facility stay during that time. Obviously, it depends on the person and your loved one, and if they're willing to go and all of that, but that is something else that they will offer.
I know a lot of states cover 24/7 in-home care, but that's just not the case in Ohio. It generally is about 15 to 20 hours a week. But as Janelle said before, even if you are, qualify for those hours, doesn't mean that you're going to get that care, because caregivers are very hard to come by, and you can't just get a caregiver off the street. They have to be Medicaid certified. And typically that's through an agency that accepts Medicaid. Um, and if you do have an individual caregiver, well, they have to go through the training to be Medicaid, certified. Um, so it's a great program that provides support in the community, but there's downfalls to that because of just the caregiving shortage that the whole country is going through. So as we've been saying, the cost of care dramatically goes up as the level of care needs goes up. Um, these are general numbers. But this is typically what you see. Obviously, independent living, some independent livings are $5,000, $6,000. But these are general numbers for you to understand that this is what you're looking at for care needs. Assisted livings, they all have different levels of what you can get. So the basic assisted living is on the low end, but if you do need more support in the assisted living, well, they're going to put you in the level 1 instead of the level 3. So the cost would go up. And memory care, which is a big component of a lot of assisted livings, you see that buzzword of memory care. We have a memory care unit that should provide more support. It should provide more caregivers. But that's really, we don't see that too often, right, Janelle? I mean, with memory care, assisted livings, the cost of care is a lot higher because you think that you're going to get more care in the memory care. But with the caregiving shortage and the age shortage, that's hard to come by, right, Janelle?
Yes. And I also want to mention that typically in one of the conversations I have with families, if you are looking at memory care, I would say the majority of assisted livings all do memory care work. I mean, a lot of their residents do have some dementia or some memory loss. What is important to think about is if your loved one is a wanderer or there's a risk of them leaving the facility, then you're looking at a secured memory care unit. That's where it really gets important, and that's where the cost really goes up. But for some places, obviously I feel like we see one story at least a year on the news during the winter. Someone walked away from a facility. Nobody wants that, and they're trying to prevent that. So part of that is looking at, are they a wanderer? Is there a risk that they're going to walk out of the facility? If so, then you want to look for that secured care.
So the Medicaid terms that we you need to, familiarize yourself with, these are great buzzwords when someone's talking about Medicaid. The 5-year look back period. People get confused by this term. Um, what this basically says is, at the date that you apply for Medicaid, Job and Family Services, who is the agency that administers Medicaid applications, they will look back on your assets and your spouse's assets, if you're married, of the last 5 years to determine, have you made any improper transfers in the last 5 years? Improper transfers is essentially a gift. You are gifting money to charity, to children, to grandchildren. Even, you know, even if you made a gift 5 years ago in perfect health to a child or to a grandchild, here's $20,000. I wanted to help you, with the down payment of the house. They're going to look at that and say that's an improper transfer because it was done in the last 5 years. You can rebut an improper transfer, but it's very difficult to do. If if they see a large amount of funds leaving your account and you're not getting anything in return for that payment, for that transfer, then they're going to count that as an improper transfer. So 5-year look back period is, they're going to look back at your assets last 5 years to determine if any improper transfers were made. If you do improperly transfer assets, Medicaid you know, would make a penalty period as part of your Medicaid application. What a penalty period is, for every $7,787 that you've improperly transferred, that's 1 month of Medicaid that they're not going to pay the nursing home. So for a $77,000 transfer, that's 10 months that Medicaid says you are in a penalty period for 10 months. You have to pay for your care for the next 10 months on your own or with other means. Medicaid is not going to pay for that care. This figure doesn't come out of thin air, although it kind of seems like it. What they say is this is the average cost of care for nursing home stay in the state of Ohio. Obviously, this is far less than what the average is in Northeast Ohio, and in most metropolitan areas, it's far less. But I guess there are nursing homes in more rural areas, more even poorer areas that have the cost of care is much less. They calculate it as $77,787. Other important facts and terms to know is the community spouse resource allowance. So Medicaid allows the community spouse to have a minimum of $30,828 to a maximum of $154,140 in countable assets. So how do you come up with that number? So before I get into that, a question came up: how long does it typically take Medicaid to complete the look back investigation? Does that cause delays in obtaining care? The investigation is, if when you apply, you have to have you swear in a sworn statement to the county that you have not made an improper transfer in the last 5 years. If you say that you did 3 years ago, you can probably guess that the county is going to review all 5 years of your statements. The investigation, it takes the county 45 days to, review an application to determine, do they qualify or do they not? If they don't make a determination after 45 days, you can file an appeal for a lack of action. Um, but that can always be extended, and the county can say, hey, we just need more time. We need to review these documents. When you apply for nursing home level of care, that's retroactive to the date that you apply. So if you apply in October of 2024 and you don't get a determination until December, it's if you are accepted for Medicaid, it's retroactive to the 1st of October. That's different for assisted living and the other Medicaid waivers. It's effective when they say you're approved. But nursing home, they're saying, okay, we understand it's a high cost of care, so it will be retroactive to the date that you apply. Um, the the community spouse resource allowance is determined by, you have to count your countable assets. And so we have to determine, well, okay, what's a non-countable asset? Well, non-countable asset are the big ones, are the ones listed here. That you have an IRA and payout status, meaning are you receiving, a monthly, quarterly, or annual distribution from your IRA? That means that that is now income. The home, your residence is exempt. A vehicle is exempt. Life insurance policies with a cash value less than $1,500, that's exempt. But that means that all of your life insurance policies have to be below that $1,500. And pre-need funeral contracts, as long as they're irrevocable, are also exempt. So everything else is countable. Your cash accounts, your brokerage accounts, anything that has a cash value, a whole life insurance policy. If that has a cash value of $50,000, then that's a countable resource. So if you count all of your countable assets and you divide that in two, if it's above the $154,000, then the spouse gets the maximum of $154,000. If you divide it in two and it's $15,000, well, the spouse gets the maximum of $30,000. So if your countable assets is $30,000, then all of that money is protected for the community spouse. If it falls anywhere in between the two, then that's your number. So if you have $200,000 in countable assets, you divide that in two, $100,000 of that $200,000 countable asset pool, that's protected for the community spouse. So that leaves $100,000 of countable resources that we have to plan for, and we can do something with that $100,000 to preserve it with special techniques with annuities and trusts to protect those funds.
Ethan, can you answer the last question and then I'll get to Holly's after you answer that?
Yeah. Yeah. So if all the assets are and no longer common and Social Security income for a spouse is in a separate account, will this be included in the look back? So everything is included in the look back. They're looking at everyone's assets, the spouse and the applicant's assets. They look at a married couple's assets together. So everything is included in the look back to determine, once again, the look back is to determine, have you made any improper transfers in the last 5 years? They also look at the married couple's assets in order to determine what is countable, what's non-countable, what's protected for the community spouse. So it doesn't matter if you have separate accounts. Everything is counted together for a married couple.
Holly mentioned, and hi, Holly. Thanks for putting this in here because this is an excellent point. So she said, my mother lived for 2 years in a memory care assisted living that required 2 years of private pay before you could enroll, if eligible, in the Medicaid waiver that we were talking about earlier. After 2 years of living there, the facility said they decided they could not afford to take any more Medicaid people, and they could not say when they would. Even if my mom could have paid for 2 more years, the facility said they would not allow her to be on a wait list. So this does not happen often, but it does happen. We've seen it ourselves. Um, Unfortunately, a lot, I don't even know how many years ago, when the assisted living waiver started, it started as a trial. Like, it had been trialed in other states, and Ohio said, we want to try it. And they've continued to leave it up to the assisted livings to determine A, if they're going to take the Medicaid waiver, and B, like, how many beds they're going to get for that. I find it very frustrating, and I'm so sorry you went through that. A lot of what we try to do is have people, like, the entrance, the admission paperwork, making sure, like, the lease or the paperwork is read through by an attorney. I When they first started doing this, I feel like assisted living's honored the fact that they set a 2 year private pay. And it's only been in the last like 10 years that they have, I found a couple of them that will kind of go back on like the agreement of this. Unfortunately, the only option is to move or to continue to private pay. And I wish there was more that could be done but a lot of times there'll be a clause in the admission paperwork that says they have the right to do this. So a couple of things. One is I try to keep track of the places that do that so I can warn families ahead of time. Just because, if you burn us once, we're going to tell you. But also I think it's important, like I said, to have the admission paperwork read by an attorney. But there, unfortunately, if that's where you want your loved one to be, it's really hard because sometimes you're taking that gamble or that risk. I'm hoping as we continue with the Medicaid waiver that they will, and it has been brought up that this is an issue. So I'm hoping that they'll continue to put more regulations on the assisted livings, like that are taking the Medicaid waiver, that they can't do that. So I'm hoping to see that change in the next few years, but I'm really sorry you went through that.
So the last term that's important to understand is this Medicaid estate recovery. Medicaid estate recovery, every state has an estate recovery for people that are on Medicaid and they pass away and they have assets. Some states are a little more lenient. Unfortunately, Ohio is one of the more progressive states in handling Medicaid estate recovery. They have what's called the expanded definition of Medicaid estate recovery, meaning some states only go after assets that need to be probated. Ohio says they go above that and say if the asset is transfer on death, payable on death, a joint account, or you know, and they have a blanket term of in or any similar fashion that can also be attacked with this Medicaid estate recovery. So what this means is that if the home, which is exempt for the Medicaid recipient, they're in a nursing home, but they have their residence, which is exempt, it's protected, they can be on Medicaid and they can have their home. If they pass away still owning the home, Medicaid can come back and say, hey, we paid you $500,000 in Medicaid benefits. We're going to put a lien on this home, which they have the right to do according to the law. We're going to put a lien on this home so that if your family ever wants to sell this home, we get paid first as the first lien holder on the full equity of this home. So when we do Medicaid applications, you have to be mindful of the non-countable resources, especially if you are a single applicant. yes, you can get on Medicaid and have an IRA. Um, if that's in payout status, that will be protected. The the home is protected, the car is protected. But if you pass away, still owning these assets, well, Medicaid can take the IRA, they can put a lien on the home, and theoretically they can take the car. It's the car is a little more flimsy because the state doesn't want to deal with any cars. They don't have the manpower to deal with the cars, but they can take the assets that you thought were protected. So how do we prepare for Medicaid and long-term care needs? Well, our first step is we just need to get the basic documents down. You have to have these basic documents in play so that if something does happen to you or to your loved one, well, they can handle the healthcare decisions on your behalf. They can get you in a facility on your behalf, and they can put together a Medicaid plan as your financial power of attorney on your behalf. So the basic documents we're talking about is a healthcare power of attorney, a living will, which is your medical directive at end of life stage, a HIPAA release, so your agents can get medical records on your behalf. And of course, the durable general power of attorney, which is the financial power of attorney, and last wills and testaments. Um, these basic documents can set your family up for the future to help care for your needs and your loved ones' needs. And also, if your wish is to protect assets for the next generation, can also help do that as well. About the durable general power of attorney, which is an incredibly important document. You can't just get a durable power of attorney off the internet or from attorney Joe Schmo down the street. You need to speak with an elder law attorney that knows Medicaid regulations and disability regulations, because these powers of attorneys you know that you get from the internet or from just an estate planning attorney don't have the provisions in there necessary to do a Medicaid plan to protect assets. So the provisions that you need in a power of attorney to do Medicaid planning and asset protection are creation of trusts, the allowance to gift, um, and the authority to apply for Medicaid. Those provisions are necessary to do a Medicaid plan and to do a Medicaid application. If they don't have those provisions in the power of attorney, these are what we call hot powers in our in the attorney world. These hot powers allow for the creation of these trusts and to gift. They have to explicitly state that in the power of attorney. And what we see in a lot of powers of attorney, even if they do have the power to gift, you're limited to the gift tax or estate tax annual contribution limit. Right now in 2024, the gift tax limit is $18,000. But what that gift tax limit is, it's for the uber rich. It's for the million and billionaires out there that want to gift assets. Well, they can gift $18,000 per person, and that wouldn't count against their lifetime exemption of which is now close to $26 million. Typical people don't have to worry about that. You can gift more than $18,000. You can gift $1 million, and that won't affect any taxes for that recipient and for that person that's giving the taxes or giving the gift. The power to gift can be limited. It can be, limited to certain circumstances and to certain people, but the power to gift shouldn't be limited to a dollar amount. So these provisions are incredibly important to do a Medicaid plan and Medicaid application. What these documents do is you're appointing an agent, you're appointing a fiduciary to be, in place to handle healthcare decisions, handle financial decisions. This person can be all four of these. We've got an agent under the healthcare power of attorney, agent under your financial durable general power of attorney. You have your executor under a will, and you might have a trustee under a trust. It can be the same person, it can be different people. If people have if children have different strengths, where you got one child that's a financial advisor and one child is a nurse, well, yeah, maybe you can divvy up the responsibilities, where the nurse is handling the healthcare and the financial advisor is handling the financial side of things. That all makes sense. Choosing the right fiduciary doesn't mean that you have the perfect person to handle the decision, because no one's perfect. But all you can do is make sure that you have the right person involved to help manage your assets and manage your care how you would. And that means you have to have a dialogue with your family members, with your children, with your friends that you have appointed as your agent, and explain, yeah, I'm appointing you as my agent under my healthcare power of attorney, and this is what that means. This is what I foresee my health. If I'm in this state, this is how I want you to proceed. If I'm in this state, this is how financially I want you to proceed. Some clients say, yeah, protect as much money for me. I want this money for me. Um, and which is perfectly fine. Use this money to supplement me. Get me on Medicaid. Use this money to supplement me. There's ways to do that. Um, some clients say, no, I want to leave something for my children. I don't want my money to be spent on all of my care. I want to leave something for my children. Please put together a Medicaid plan on my behalf. So, like I said, we don't want people left in the dark. We need to have a dialogue. We need to, explain your wishes, with healthcare and financial decisions if you're ever in that state.
Real fast too, I just want to add that if you do have multiple people that are making decisions, just because someone's your financial power of attorney and someone else is your healthcare power of attorney, they should still know what your wishes are. And that's to prevent arguing down the road. I can't tell you how many siblings come in and they're like, the healthcare power of attorney is my sister and she's making all these decisions, but she's acting on what mom had told her to do, but never shared with the rest of her children. I get it. It's an uncomfortable conversation. I understand that nobody enjoys this, but you are going to prevent a lot of like undue burden down the road for your loved ones if you talk to them, express your wishes, and they really should act on your behalf. So sometimes your spouse isn't the best person to be your healthcare power of attorney. If they're not able to follow through on your wishes, if they say, oh my gosh, I could never make that decision to not have you on a ventilator, that's not the person who should be your healthcare power of attorney. It should be whoever you trust to act in your best interest. And I cannot stress that enough, because I think we get a lot of families that are like, well, I named it by the order my children were born. And that's not always the best plan. And sometimes they don't want that responsibility. So again, like Ethan said, make sure you check with them and make sure they want to follow through on these tasks.
So the last topic with the, financial, and the financial means and the terminology here I wanted to discuss was this Medicaid Asset Protection Trust. This is a great tool that we use, to prepare for Medicaid, where if an individual comes to me, or a husband and, a spouse come to me and say, hey, I want to, you know, prevent any of my assets going to Medicaid, or, prevent as much as possible, to, on my care. What can we do? Well, depending on the circumstance, we can set up this type of trust called a Medicaid Asset Protection Trust. It's an irrevocable trust. So what a client is doing is they are gifting intentionally, maybe their home, maybe some cash, maybe some other assets to this trust. They are no longer the owner or beneficiary of this asset. They would be able to maybe live in the home, um, but they would no longer be owners of the home. The trust would be the owner, and their children would be the beneficiary. If you wait 5 years before applying for Medicaid, well, the 5 year look back period only looks back 5 years. So if you transferred assets to an irrevocable trust 6 years ago, you just protected those assets. It's in the trust. They're not going to even see that because they only see the last 5 years. So this is a powerful tool that we use. Some clients, they don't want to do this. They don't want to relinquish any control, ownership over their assets, over their money. What I tell clients is, well, we're not going to transfer everything. You need some, if not most of your money, but we can protect at least a portion of it. And that money can be set aside as you would want for your children at your death. It could be set aside now. So you're speeding up your estate. You're doing your estate while you're alive by transferring it to an irrevocable trust. Once the settler passes away, then the assets are then distributed to the beneficiaries, whether that's the house could be sold, the proceeds divided amongst the beneficiaries, amongst the children, the cash, essentially, as an executor would do under the will, they would pay out any debts and expenses, but nothing to Medicaid because Medicaid is not attached to this trust. So we're going, as the months go on here, we're going to talk about, Medicaid protection, these trusts, techniques that we use for what we call crisis planning. If you need to get on Medicaid right now, we're going to talk about that in later presentations. But I just wanted to give you a taste of, there are ways to protect assets. We have the community spouse resource allowance. There's exempt assets. There's different planning techniques for a married couple compared to a single applicant. And we have this trust, and we have the powers of attorney. All of these documents and these techniques are ways to prevent all of your savings, all of your assets being depleted on long-term care.
Hey, now we're up to backup plans. And anybody who's worked with me knows I love to say, I'd rather you have multiple choices than deal with a crisis. So whenever we're looking at, like what the future holds and our anticipated needs, I think it's good that you have like your ideal plan A, right? Like this is what I really want. I want to remain in my home as long as I can if this works out. But it's always, always, always good to have a plan B. Should something happen and you need skilled care, should something happen where you fall unexpectedly, what does that look like? Now is the time. Go to facilities, walk in, tour, ask questions, interview caregivers. I think the sooner you start thinking about these items and what your future holds, the more power you have. It gives you more choices. So you can go to your healthcare power of attorney and say, okay, I want to stay at home, but I also realize that due to some accessibility issues, if this happens, I need to go to an assisted living. Or, God forbid, if something else happens, C is a nursing home. But I already went and I looked at these and I'd be comfortable here. Is it ideal? Probably not. That's where I said, like, having a backup plan is so important. And again, it takes the burden off of your decision makers, off your family, to know that you've looked at this ahead of time and that these decisions are your decisions. So it really helps with your independence more than anything. Discuss this like with your support team, whoever that might be, your friends, your caregivers. Start talking about those things, having a discussion. You'd be surprised. I mean, I have literally, I feel like I've seen it all in this being a social worker, but sometimes neighbors are like, if you ever need help with X, Y, or Z, I'd be willing to step up and do that. I'm right here. You just never know. So I think having a discussion, if you have concerns, if you're worried, talk to your family. Some people assume their children are going to take care of them, and that's not always the case. Maybe they're not able to, maybe they have children of their own that have some needs that does not allow them to be accessible to their parents. It just depends. So I think talking is important. Also including your healthcare team in your decision making. One, any documents you do complete, like a healthcare power of attorney, a living will, a HIPAA release, or do not resuscitate, should be in your electronic medical record. They can help you do this. You could bring it into them. They'll make sure it gets uploaded. The nice thing with that is if you do go to the hospital, it's not up to your daughter to hurry up and find the box that you put these in and try to locate it. And this way the communication's easier. They're able to speak to the people that they need to speak to for decision making. Also, making sure you update your primary care physician and any specialist that you might be seeing. Let them know what's going on. Say, I've had a change in level of care. I feel like lots and lots of people go to the doctor and go, everything's fine. But all this stuff happened in the 6 months between you last saw them and now, but maybe you feel okay that day, so you forget to tell them everything. That's where like these electronic medical records can be so helpful. You can shoot them a note. You can say, hey, something's changed. My daughter moved out of town. She was my support. So I'm on to plan B. And that looks like this. Just so that they're in the know and they can help you too in figuring out maybe you need them to write a letter to your long-term care and insurance policy, proving that you need help with certain things. They're already on it and they're already aware of it. And that's just going to make getting that information so much easier. So preventing abuse, neglect, and financial exploitation. Obviously, nobody likes to talk about this, but in Ohio, the Ohio Revised Code 5101.60 defines abuse, neglect, and exploitation of adults. And I will just read it to you very quickly. It just says, inflection upon an adult by self or others of injury, unreasonable confinement, intimidation, or cruel punishment with resulting physical harm, pain, or mental anguish. So I know that seems kind of broad, and I work a ton with adult protective services. There's an adult protective services in every single county in Ohio. Now, some get more money than others. Some counties, Cuyahoga County gets a little bit more of the pie, so they have more workers than other counties. Anyone can report to adult protective services, even if you wanted to report on yourself. I know that sounds ridiculous, but we've had situations where someone had a caregiver that they felt was really taking advantage of them and they really weren't sure how to handle the situation. They called adult protective services, who came in and intervened, and it gave them an out. It got rid of that person. Maybe they were uncomfortable telling him the truth, or they felt like there was some exploitation going on. It allows adult protective services to investigate. I always tell people, if there's nothing wrong going on, there's nothing to be afraid of. Adult protective services is going to come in and they're going to determine, one, are you someone who has capacity, or are they concerned about your capacity? And then they're going to investigate whatever the allegation is. It could be financial abuse, it could be physical abuse, it could be self-neglect. They have a job to do. And so they're going to investigate. And I truly believe that, I would say the majority of the time, if it's not a substantiated complaint, they come, they meet with you, and they walk out the door. So it's not as terrifying as people seem to think. But currently, when APS is working with families and caregivers, some of what they do is work with local police departments. That's because some of these cases rise to the level of a criminal case versus a civil case. So they are working, they're trying to get the education out there. They're trying to work with people to speak up when they are being financially exploited or abused. And I use that as the most common criminal case. Unfortunately, sometimes there is physical abuse, sexual abuse. And sometimes the self-neglect can really rise to a point where they need to get someone assistance. So there's also undue influence. So undue influence is a term where someone does have capacity on a normal everyday, they typically have capacity, but there's someone in their life that has kind of tilted the power um equity, and so they're feeling influenced. So for example, I had a mom that was at home with her daughter who was the caregiver, and over time the daughter just kept saying, gosh, if it wasn't for me you'd be in a nursing home, if it wasn't for me you'd be in a nursing home, which sounds okay, but over time she was influenced into thinking that if she spoke up and didn't stop like the manipulation and the abuse, that she would end up in a nursing home automatically, and that's not necessarily true. So it's sort of that power differential.
So a question came up back to the Medicaid Asset Protection Trust. Said it's an important tool. Sounds like it could be an important tool for parents of disabled children to protect assets, um, to which the parents prefer to be passed to children, typical or disabled. Um, it is. I mean, the the irrevocable trust is it's an important tool to protect assets for any of your children. There's also other types of trusts that we utilize for disabled children. And the reason why we utilize those trusts because those types of trusts, whether that is a sole benefit trust, um, or a special needs trust, those are exempt transfers for Medicaid purposes. So any transfer to a disabled child or to a disabled child's trust is you know, is allowed. There is that is not an improper transfer according to Medicaid rules. And if it's going to a sole benefit trust, then that trust would be protected for that child's benefit, so their benefits will continue. And if that child passes away, the there would be no Medicaid payback to the state from that sole benefit trust. It would go to the other children or to other charities, whoever that the settler has. The the biggest, sticking point is the person relinquishing control. That is the biggest downside of transferring the money. And the other downside is if a person needs Medicaid within the 5 years, if something does happen to that person, well, we have to undo the trust. It's an irrevocable trust, so we have to go through these steps to undo what we've done. So the downside is, okay, paying the attorney to do all this work where we have to undo it because now we have to get on Medicaid within that 5 years, and we have to do a Medicaid plan with undoing the trust. Um, it's an important decision to make. It depends on a person's circumstances, their healthcare needs, how healthy are they now? Um, that all goes into whether an irrevocable trust for asset protection makes sense. Um, but back to preventing this abuse and neglect and financial exploitation, a lot of people, a lot of social workers, I got this term from Janelle, they call a POA, a financial power of attorney, a license to steal. Um, the power of attorney can be a license to steal because you are allowing this person to step in your shoes and to make transactions, to make gifts, to make trust planning on your behalf. If you're incapacitated, well, you can't really stop them because you can't revoke it. You're incapacitated. This person has all access and control. Well, that goes back to choosing the right person. And you don't want a child who has their own financial issues and their own healthcare issues making financial decisions for you. Um, But it also goes back to making sure that the power of attorney is drafted correctly and appropriately for you. There are provisions in a power of attorney that you can make to prevent any of this from happening. There are oversight provisions and consenting parties provisions where if a person wants to gift, they have to have the consent of another party or a group of people to make that transaction. Um, you can have a person overseeing that this agent where they can have access to bank accounts, and if they don't, if the power of attorney doesn't provide that access, well, the consenting party can remove that agent. There's You can craft a power of attorney however you see fit. These powers can be inputted in there to make sure that, you know, a child or another family member doesn't run off with your money as power of attorney. We see that in the news all the time where I think it was just a year and a half ago, a resident from Westlake lost $900,000 and his because his agent, I think it was his niece, took the money. Um, and she was the power of attorney. I've had clients that have done the same thing where we actually went to the police. We went to the Ohio Attorney General's office and said, "Hey, they stole $150,000." Well, you're kind of stuck in your tracks if that person granted them agency under a power of attorney. The police's hands are tied in a lot of cases because of that. So having the provisions in the power of attorney can help with that. Um, Another question came up about the trust. Um, does the use of phrase undo the trust mean that even an irrevocable trust can be changed? Yes, an irrevocable trust can be changed. In Ohio, there are three main mechanisms that you can amend an irrevocable trust. There's certain parameters around it, but through a decanting agreement, a private settlement agreement, or through the courts, you can change an irrevocable trust. Um, the other way that I undo an irrevocable trust is the beneficiaries of the trust are the children. You gift or you transfer the assets to the children. The children would then have to gift back the assets to the parent. Um, that's one way you can undo the trust, but you can amend an irrevocable trust. There's certain parameters around there that you have to follow, and a lot of steps that you have to take, but it can be done. Other ways, that you can protect yourself or can protect your family member. I mentioned this before, the lifetime residency agreement. If you do an irrevocable trust, you transfer the house to the trust, you can still stay in the house. You can have a lifetime residency agreement that will allow you to stay in the house as long as you're able to. You can have a trust advisor in place over the trust that will be the check and balance on the trustee. So if the trustee isn't doing a right job, kind of like a consenting party, an oversight provision in a power of attorney, that's what the trust advisor does as well. Then we also have advocacy language that we can put into trusts where Janelle's services, like a professional care manager, can be put in place to watch over any healthcare or uh, placement needs for that individual, for the beneficiary, or for the settlor in this case. So there's a lot of ways that we can help prevent this abuse, neglect, and exploitation. A The right elder law attorney can help craft that language.
So, there are so many scams going on right now. I couldn't even list them all. It's very important that you're educating. I don't care how old you are or what kind of situation you're in. You need to educate yourself about current scams. There's all different kinds of ways to do that. There is a scam squad of Cuyahoga County. Anybody can go to the website and check it out and hear about the current scams. Also, the Attorney General's office has an elder justice unit. And just because it says elder in it doesn't mean that you are too young to look at it. Some quick examples of what's going on right now. And part of what I do is try to educate my clients about these scams when I think they could be vulnerable. But, and I'm jumping ahead to, with trusted loved ones, it's important to talk to your family. I have an aunt who is in her 80s, and I talk to her regularly. Like, has anybody asked you for money? Have you gotten any weird calls? Is there anybody reaching out to you that shouldn't be? Talk about it, be open about it. I think people are so embarrassed when they do get scammed. And I will tell you, anybody of any age can be scammed. I think the biggest one that gets a lot of people right now is this Microsoft scam. Like, you'll be on your laptop and a box shows up and it says, you have to pay $400 to fix this Microsoft virus, whatever it is. And you click on it and you think it looks legit and it says Microsoft and it's all these things, but it is a scam. And a friend of mine, her dad just ended up spending a couple $1,000s until he realized it and called someone that could help remove it. There's a lot of rental scams. We had someone in our own office that thought that they were going to look at a rental house, and it was actually a house that someone had just bought, but they were trying to get this person that reached out to them was trying to get the deposit off of them. The grandparent scam. Oh my goodness. Please talk to your kids and grandparents about this. Have a plan in place. Like, hey, grandma, if you ever get a text that says I'm in trouble, so this is what the grandparent scam is. They call and they'll text them or call them and say, grandma, I need your help. I'm stuck. I have no money. Can you hurry up and Zelle me some money or Venmo me money or PayPal me money or whatever it might be? It's good to have something in place. A lot of times people will be like, oh my gosh, sure, honey, I'll send it to you. And they send it and then they find out they're totally fine and it wasn't them. So I know it sounds like it's really easy to spot these, but it's not. So it's really important to be open and talk about it. And please report it. If you are taken by a scam, regardless of what it is, please report it. The Attorney General's office keeps track of any scams. I know a lot of people are on Nextdoor, that app, and you go on there and everybody's reporting all this stuff. I see scams reported on there all the time. It needs to go to the Attorney General's office because they keep track of what's going on so they can better help people know what to look for. The last thing I'm going to say is you should always, always, always be able to see your information and have access to your money. So a lot of times individuals will say, listen, I'm going to have your mail forwarded to me. I'm taking over. I'm trying to help you pay your bills. That person should always be able to ask, how much money do I have? That person should always be able to see their bank statements. That person should always have some sort of money. Leaving someone sitting in their home with no access to money of any kind is not okay. And I think if you are that person, it's not okay that someone's doing that to you. So that's something that I really stress is you should always be able to see your information and always have access, regardless of of what documents you've completed. Even if they're power of attorney for finances, you should be able to ask those questions. And the last one is about my role for care coordination. I do try to pretty much anytime I meet a client or a family member or caregivers or anybody, I do try to do an assessment of the situation so I can best help, because obviously everybody, has a different situation. So a lot of what I do is assessing for level of care, adequate supports and safety, like we mentioned at the beginning. I can also help with assistance with placement or care options. Um, a lot of what I do is advocacy. So I do try to speak up for individuals who are being maybe abused or neglected or exploited. And I'm always kind of that second set of eyes and ears. But Ethan, there's another question.
Oh, so it's about long-term care insurance. I think that the market has stabilized with long-term care insurance. I don't really see, you don't see that in the news too often anymore, about policies, you know, canceling. But it's worth noting that, it could happen. This webinar wasn't all about long-term care insurance policy. It was about, the financial, it was the 5 steps to proactively plan for long-term care. The long-term care insurance is one component of it, and long-term care insurance is not going to protect all of the needs for long-term care. Um, a lot of policies, um, will it depends on what the policy is. A lot of policies will pay out for a certain period of time, and it will be capped at a certain level. So, you know, it's hard to say. I mean, the attorney answer is it depends. But if I would suggest that you speak with an attorney, and not just your insurance agent that's trying to sell you the policy, but have an attorney, go over that policy with you before, pulling the trigger and purchasing it. It's a great tool. But it's just one tool out of the toolbox here.
Well, and I think it's important too to do your research, right? So you really want to look into the policy. And if they do have clauses in there that say, hey, if things aren't going, you got to read the fine print, right? Always. So I think just over the years, my experience has been, do your research on the company, make sure they're a company that's been around for a while, not just like one of these pop-up ones I know like shows up on TV sometimes, but I think it's important to just do your homework and now you know that this could happen. So I think it's reading the policy very carefully. And believe me, I know they are super long and very legal ease, but it's nice to it now you kind of know what to look for. That'll help a lot.
Okay, with that being said, we're out of time, and we're out of slides. So what we're going to do is we're going to put this presentation, we're going to put the slides up, for everyone to view. We're going to have our next, presentation next month, um, you know, which is more about Medicaid and eligibility. So we look forward to seeing you all. So everyone